the differences between, you mentioned TENS and Accel Heal, and whether you'd ask the question about what the difference is between the Accel Heal and a TENS type machine.
No, I haven't had that question yet. I think there are probably 3 or 4 main differences between those two types of devices. People have been using TENS machines to stimulate wound healing and reduce wound pain for quite a long time, and they have been shown to have some effect, but they are supra-threshold stimulation devices, which means the patient is aware of the sensation of them. And as I said in my talk, when people are aware of that paresthesia, that pins and needles and tingling, it isn't always tolerable or comfortable for them. And I think that's more so the case in wound pain. So they're not necessarily very tolerable. So when you have a microcurrent stimuli, subthreshold stimuli like Accel Heal, for example, then it's much more tolerable for the patient. So that's one of the differences. I think the other differences are the ability to the microcurrent, the low amperes of that current is actually operating at a really good level to stimulate wound healing, whereas in a TENS device, you've got to fiddle around with your settings. So with a specific bespoke device for wound healing and pain management, you're delivering the current and the hertz and everything in the right quantities over the healing period. It's also specifically designed so it doesn't fall off your bandages and get caught up in the long wires trailing out everywhere. So it's portable, it doesn't reduce mobility quite so much. I think one of the other things that I've noted from a little bit of research that goes on is TENS machines tend to be associated with quite a lot of skin deterioration or damaging the skin in some way. And it's probably because of the way the settings as well as the size of the pads that are accompanying it. And of course, with wound pain, you're very keen to maintain skin integrity. And a lot of patients with chronic wounds have got quite vulnerable skin around the area of that wound. So certainly the research that's going on with the Accel Heal device is not noting any skin deterioration around those wounds, but there has been quite a lot of skin deterioration noted with TENS devices. So that's yet another reason. And then there's a final thing, I think, about the way that the device delivers current, and it all feels a bit magic to me because I'm not a physicist. But when you look at TENS devices, there's quite a lot of habituation and there's quite a lot of clunkiness in the delivery of stimuli. So I think some people can use them very effectively. But one of the things that Accel Heal does, which is even different compared to other microcurrent stimulators, is it cycles through a range of these different I'm drawing a waveform and not remembering the name. Sorry, it cycles through different waveforms, different currents, and different frequencies, and it also delivers that in a sort of spaced way throughout the day several times. So you're not getting habituation and you're reducing the amount of visits that your nurse has to give or the instructions your patient has to follow, and you're just basically able to leave it in place. So I think I'll probably come up with about 12 reasons there. But I think the bespoke devices certainly seem a lot better at the job.